Good morning, everybody. This is the Board of Health meeting, June 23rd, 2025. This meeting will be taped, and we're meeting at the Norwood Senior Center. Kathy's not able to be here today, so unfortunately, for you people, I am the chairman for the day. We would like to start the meeting, call to order at 10:30, and we'd start off with the approval of the minutes from our last meeting.
I make a motion to accept the minutes of the meeting.
Okay, and I guess I can second it, and
Yeah.
all in favor?
Aye.
Okay, so we're all set for that. Next thing on the agenda, we were going to review the update, the tobacco regulations for the town of Norwood, but I think we're gonna
Definitely.
put it on hold until we have a full board meeting. So just be aware that in September, the first thing we'll be talking about is the review and the updated tobacco regulations for the town of Norwood.
They're too specific not to be a full.
Yeah, and there's not, it's just not any major things, but I would like to table it
No,
for this
definitely.
meeting. Okay, moving right along. Under old business, we're gonna have the public health nurse report.
Diana is out.
She's actually out doing the camps.
Okay.
She's out looking at camps today, so,
Okay.
just if you look at it, if you have any questions for her,
Yeah, I don't have any questions. We're just talking about the respiratory viruses that are still going on. COVID-19 vaccination is recommended for people ages 6 months and older. There's 2 types of COVID-19 vaccines that are recommended for use in the United States. And there are 2 COVID-19 schedules to be followed. Anyway, anything you want to add?
yes, we now have MMR.
Okay.
We have through the
We have
vaccine,
it?
through the
MMR.
Vaccine for Children program. So for children up to through the age of 18, if they're missing an MMR.
Okay, that's mumps.
Measles, mumps, and rubella.
Yeah, right.
Yes,
We have that vaccine?
we have
Yeah.
that
Is that the
vaccine.
first one, what time we've gotten that?
We've done it in the past, we've done it for years, and then there was a few years, we didn't really
We didn't
need,
do
we
it,
didn't
yeah,
have a
we
need,
didn't need it.
and, you have to, if you can't let it expire, so it was very difficult to have it, when it expired. We used to give our vaccine when it was getting close to the expiration date to Norwood Hospital, to
Mhm.
Norwood Hospital Pharmacy,
Right.
but, there just wasn't a need for it, so we didn't order it, but there's a need for the MMR, so we do have it in stock.
Age grouping?
It's vaccine for children, so it's for, basically, we're
18 months?
doing, well, we're not doing them that young. So
Okay.
we're doing probably, I would say kindergarten up through 18.
Yeah, they need to have it in
Wow.
order to go to kindergarten, they need to have it.
Yes.
Yeah.
So anyone missing, you can give us a call, and public
Okay.
health nurse will set something up. The schools have also been notified too, so the school nurses know that we have that vaccine.
So when your kids were off to college, Stacy, they had to have a booster of this, I didn't know.
No, not MMR.
Oh, okay.
Meningitis.
Meningitis.
Meningitis is important for kids going off to college.
So, that's it for the nurses, public nurses' health report. I don't see her telephone number in there, I know I have it on my phone, but do you remember?
Just the town hall.
Just the town hall.
781-762-1240,
Okay,
or health@norwoodma.gov.
okay,
Yes.
all right. All right,
That's great.
Environmental health inspectors report.
Morning, Angelo.
Good morning, how are you? There were no updates for today's meeting on the
Okay.
update list. We'll go to the new food establishment report. Crave has opened, we're given their permit to operate. Any questions on the new food establishment report?
I just had a couple, I wanted to make sure that AJ's Market had their food permit posted.
Oh, we'll go through, okay.
Yeah. Oh, I'm sorry, you were going.
Oh, it's okay, no
Okay,
problem. Yeah,
all right, we can do
That's
that, all
fine.
right, so Crave is open now.
Yes, Crave's open,
Okay.
correct, yes.
Washington Street,
Yes.
Hometown Arcade.
Oh, and Royal Creamery, those two, I haven't heard back from them, but we haven't heard back from them as far as what the update is on their
Okay.
pending opening, so.
And that Crave is formerly, used to be Little Tony.
Correct.
Okay, now to the big one.
What's going on with Cedar Market?
Okay, I haven't,
They have bare hand contact when they were prepping ready to eat food, so
Say that again, Kyle, I can't hear
they were using bare hands on ready to eat food. So I addressed that with them when I was there. And the cutting board that they were using was old and really cut up, so they got rid of that when I was there as well.
Thank you.
okay.
Do they have gloves on the premises?
Yeah, they do.
And who did you speak with there?
The person who was doing it and the manager that was going around.
Was it the, butcher?
Yes.
Now, is that the same owner as one time sold? From the boys they had?
It's the same order from,
From that, sold it from those boys?
Correct,
Okay.
yes.
I didn't know if it was sold again.
no, it was not.
Okay.
I was gonna suggest we put them on the list just to pop in and make sure they'll use
Okay.
their, gloves.
And how do they take your inspection, okay?
Yeah, they're fine.
We're getting them warmed up to us, are we? Good.
Thank you, Kyle.
Daddy's Dairy, I wanted to check on that.
Thanks, dear. Yeah, there were no critical violations during the inspection. They were pretty compliant overall.
Okay, they were gonna, schedule the defrosting of the freezer. Has anybody checked to see if that happened?
No, that's something they do regularly in the past that I've seen them do. But they should be doing that soon. It's usually on their schedule. Usually schedule this time of year because the buildup gets really bad in those freezers. So,
Okay.
yeah.
Is Launch, the site of the fire, is that up and ready?
Yeah, I went in there a few times, and Angelo said he drove past there over the weekend and they were open.
They were open?
Yes.
And, how about, Masa Hibachi? Gonna re-inspect?
There's no inspection required there. There were no critical violations.
Okay.
Yeah, so I think they'll be inspected within the next few months as well. So.
Okay, yeah, the boxes
so-
on the floor and soiled equipment and stuff like that was all.
Yeah.
Okay. Anything else?
No, but these ice cream trucks, there has to be two in the truck. Is that, do I understand that? I thought so, Jen.
No,
Stacy,
no longer.
No longer?
No.
No,
Why?
That wasn't our regulation.
it was a police regulation.
Right.
Damn. I did like two in the truck. It's for
Yeah.
protection of our environment,
And safety of the kids.
most importantly.
Yeah. Is there anybody you'd like to talk about?
There's nobody on the list that stuck out to me, to be honest. So I do not have anybody, no.
How about you, Cal?
No, and I'll follow up with Cedar Market.
Okay. Alright. And then, oh, the food permit, AJ's Market.
Yeah, I'll make sure they get it posted, yeah. I'll reach out to them. Yeah.
The Cafe K opened, I heard great things.
The old perks.
Cafe K
Yeah, the old
Streets.
perks, yeah, they were doing the permit a while ago, so I guess they just know me. So.
It's not news, it's not
Not,
news.
yeah, not news to me,
Yeah.
yes, exactly, yeah, so.
Okay. So it's open and running and.
It's open,
The
yes.
tape is off the window and all that stuff.
I believe so, yes.
Okay.
Thank you, gentlemen.
Okay, thank you.
Thank you. Well done.
Of course, thank you.
Thanks. Oh my. We're down to the director's update.
How efficient you two are.
I know, huh? See that?
Oh, so for me?
Yes,
um,
please.
Yes, June 3rd, we participated in our first time Student Government Day at the Copley Middle School. All the department heads went down and just circulated through all the kids' homerooms and just told about what we did here and for me about what we do here in the health department. And the kids were able to ask some questions, and it was fun. It was a good day.
Good.
So they're getting the kids ready for Student Government Day that they'll be able to attend when they get into high school.
Nice.
And how we do the mock
Uh-huh.
town meeting and
That's always
the
been a
town
nice
halls.
time for the
It's a
kids.
great time for the kids, but so this was the first time, and it seemed to go over well, so hopefully we'll do it again next year in the new school.
Beautiful. Good.
I already told you about measles, the measles vaccine,
Yep.
so I won't talk about that again. And then the West Nile, we've had our first West Nile virus positive mosquito sample, which is a little early,
Yeah.
happens every year.
Right.
As you know, they take samples throughout the state of Massachusetts, where you get thousands of mosquitoes, you grind them up and then test it. And so it tested positive for West Nile virus. So just let you know that it's time to start spraying, using your DEET when you go out.
Does it detect the community, like Norfolk County, Suffolk County?
When they
When they
spray?
when they scrunch up the mosquitoes, like you said.
Well, yeah.
What's the question?
Okay, well, so you said that they scrunch up the mosquitoes and they see if they have West Nile. Does it determine the section of Massachusetts
Oh,
that's it?
so this sample was taken in Worcester County.
Okay,
Yes,
that's what I meant.
yes, so there's different areas throughout the state of Massachusetts.
You're correct.
Yes. And so that happened to be in Worcester County. But, if it's in Worcester County, it's gonna be everywhere.
All
So
right.
that's our first positive sample. It doesn't really predict that it's gonna be a worse year or not, a worse year than usual,
It's
but
earlier,
it's-
though,
It's a
this
little
year.
earlier, but just, again, it's just to remind people that this time of year, use your DEET spray. And with all the rain, it's really to be expected, but go around your yard, empty containers that are out, we don't want any standing water. It doesn't take much water, inch of water. Doesn't take, you don't have to big pools of water.
Right.
Little puddles will dry up quickly, but with this rain, it's been, haven't had a chance for things to dry up, but it's just a reminder to people.
So I found a dead bird as I called you immediately in my yard, and I was like, oh, who do I call? Stacy. Just to see if it has to be tested or,
Yeah, no. So that was years ago. There was a program, you're right, because I did drive around and pick up dead birds
Yeah, I
and send them
didn't
to the
know.
state lab. But that's, a lot of times that happens in the beginning when you're trying to see how widespread something is. West Nile and Tripoli are here, we know they're here, so you do the preventative measures, don't get bitten, and kind of
Yeah.
control what you can in your environment.
So stay indoors and, when you're outside, wear long sleeves if you can.
Yes.
And, things like that. Yes.
Socks.
The age that you're supposed to start using bug spray on kids.
oh,
Well, you always check with your pediatrician, but
Right.
with certain concentrations of DEET,
Right.
you want below 30% on young children,
Right.
and then you're not supposed to put anything on anybody under the age of 2 months.
Right.
But check with your pediatrician to see what's safe. But
What's
that's
safe.
the general guidance, yeah. You don't want, babies, remember, put their hands in their mouth, and they're extra sensitive to chemicals, so
Yes.
you don't wanna be spraying a newborn with DEET,
Right. Well, I just wanted to go over the, application so that, there's a lot of young mothers out there that don't know the difference, so, okay, that's good.
And then, my last and biggest news is the dental program. So as you know, the last couple of years, we brought back the dental program, Affinity Dental, Dr. Naya Kundi, and he was doing the school dental program, doing the screenings in the school, and then anyone in need of cleanings, fluoride, and x-rays could make an appointment and be seen in his office. He is no longer available.
Oh.
Yeah.
That's too bad.
We're kind of, to be honest with you, all the kids were screened, which is great, and they would get a report home, but nobody utilized it. There wasn't a big utilization
oh,
of it.
that's so
But it's
sad.
kind of a good thing, because Mass Health now covers it. So years ago, there was no dental insurance, there was nothing to cover your dental. So
I
now.
love Dr. Stone's.
Yeah, so it's kind of a good thing. because
Gee, we
people
were busy
are
when I did the
receiving-
clinic with Dr.
Yeah,
Stone.
because
Oh,
you
my
didn't
goodness.
have dental insurance. You either had to get it through your company, or if you had Mass Health, most people didn't take it. So now it's kind of, it's out there, people have it.
Common, yeah.
So they already have a dentist that they're seeing. They're
Well,
being seen, so.
maybe in the fall, we can wait and see if the nurses feel
Yes,
that they need to this to be started up again, and we can look into it.
Right.
And maybe find somebody, but
It's
we'll
gonna-
wait for their input.
and you remember, he gave up he closed his practice on Fridays.
Right,
yeah,
And
that's
it's
a huge
ridiculous.
day.
So it's huge, they're so busy right now.
Yeah.
But
Where is Affinity Dental?
Walpole Street near the library, that
That
next
building.
office beside the library, there's like a.
4549 Walpole Street.
Yes, exactly.
That's where the OBGYN guys were.
Oh, okay, so
Right,
that's,
that's right.
that's where he is, and just, he had some office changes in his office, and it's just,
Okay.
because it would be him, and he would bring a dental assistant, so it was a lot for him, and then to not have people come.
Yeah.
Um,
And he used to go to each school, just like Mark.
He went to every school, and like I said, he closed
He
his
did a
office on
wonderful
Fridays.
job. He really
He's
enjoyed
great,
it.
and
Yeah.
we were very grateful for him to do this. But if people are being seen, and they have insurance, and they're going to their dentist, that's great, that's what we want.
Like I said, we can work with the schools in the fall.
Absolutely. And that's it for me.
Thank you.
That's it
Stacy.
to you? Oh, my goodness.
I don't have anything this month.
No, we wanna set up a date for the next meeting in September.
Okay.
And does anybody have any time that they can't do it?
I cannot do it the 9th of September.
Okay. All right,
I can do the 16th on a Tuesday. Oh, do we do it Monday or Tuesday?
Usually Tuesdays, but
oh, Tuesdays, okay.
I think it's been Tuesdays.
I can do it the 16th.
Okay, that works.
Yeah.
Okay.
Okay, 10:30 here,
Yep.
alright.
Are we ever gonna be able to get back to the town hall?
Not really any space.
Yeah. Okay. Ladies' room busy? That's about it. Okay.
Then the inspector's gonna come.
There's no space for a meeting?
Does the DPW have rooms, meeting rooms?
I mean, I think this is,
Oh, this is fine, I
It
just
is.
wondered, yeah.
I don't know.
We're looking for mileage.
Oh, jeez. Yeah, we get paid the same.
Yeah. I make a motion, we, go to Tuesday, the September 16th, and I make a motion, we close the meeting.
All in favor?
Aye.
Aye.